Hi everyone. So the final hormone I want to cover on the adrenal gland, adrenal cortex is aldosterone. So we've mentioned cortisol hormone, which we related it to Addison disease and Cushing syndrome or Cushing's disease. Now, the next hormone we want to look at is aldosterone. Aldosterone is a steroid, is also a steroid hormone, okay, found in the adrenal cortex. So the purpose of aldosterone is that it works well in the kidneys. So it helps to maintain and balance blood pressure, okay, by is regulating the amount of water and sodium in the kidneys to maintain or to balance out, to maintain blood pressure, period. So, um, when aldosterone is in excess, which is hyperaldosteronism, right? Excess production of aldosterone hormones just means that there's excess water, there's retention of water, and when and sodium. So there's retention of water and sodium when aldosterone hormone is in excess. Therefore, if there's um, excess or retention of water and sodium, that will now lead to hypertension. The blood pressure will go up because volume is being increased, right? So water and sodium, the body is retaining, the kidneys is retaining water and is retaining sodium. So sodium levels are high, the water levels are high. So of course, hypertension. And again, I mentioned in one of the videos that in the adrenal gland, whenever sodium levels are high, what is happening to the potassium levels? They drop. So hyperaldosteronism, or if aldosterone hormone is in excess, we have sodium retention, which is hypernatremia, so high sodium levels. So therefore, when the sodium levels are going up, then the kidneys will start excreting potassium, thereby depleting potassium levels. So for hyperaldosterone, sodium levels are high, potassium levels are low. So what would you do for diet? Okay, so you teach diet accordingly. So of course you want to give your patients a low sodium diet, the diet that is low in sodium because their sodium levels are already high, but then you want to supplement diet that is high in potassium because they're excreting a lot of potassium and their potassium levels are low. So that will be the diet that will be recommended for hyperaldosteronism. Okay. Then what about the opposite of hyperaldosterone? Again, aldosterone is supposed to maintain blood pressure by balancing out fluids, water and salt, or water and sodium in the kidneys. So when aldosterone levels are low, it will be, of course, the direct opposite, right? So now the kidneys will not be able to hold salt or sodium. The kidneys is having difficulties retaining sodium. So if kidneys are not able to retain sodium, then the body start losing sodium. And water follows sodium, right? So when sodium is being depleted, water follows that. So think of it, if water follows sodium in hypoaldosterone, where we have depletion of sodium levels, we will indirectly have depletion of volume because water follows sodium, right? Because water follows sodium, so you're depleting volume. Whenever you're depleting volume, think of your vital signs. Your blood pressure will drop because volume is low, right? Blood pressure will drop, so your patient is at high risk for hypovolemia. Okay, hypovolemia. And then what are some of these signs and symptoms of hypovolemic shock or hypovolemia? Low blood pressure but high heart rate. So the blood pressure is low but they're tachycardic. So now electrolytes. Okay, so because we're in hypoaldosterone state, we're losing salt or we're losing sodium, what will happen to potassium? Will keep potassium, because remember, whenever you're losing sodium, potassium is going up. Whenever your whenever sodium is increasing, potassium is dropping. So opposite. So hypoaldosterone, now we're losing sodium, we're losing salt, therefore potassium levels are up. So again, look at diet. If you have a disease process that shows those findings, what would diet look like? Okay, what would diet look like for your patients? So again, this is just an overview of the hormone aldosterone. Again, is found in the kidneys. It helps to regulate blood pressure, maintain blood pressure by balancing out sodium and water. Okay, we have hyperaldosterone, where the body is retaining salt and retaining water, thereby increasing blood pressure. Okay, so your patient will be in hypertensive, they could go into hypertensive crisis. But then again, as I mentioned earlier, when you're keeping salt, you're dropping potassium. So in hyperaldosterone, they're excreting a lot of potassium, therefore decreasing the potassium level in the blood. So patient will be hypokalemia. So what are some of the signs and symptoms of a patient that is losing a lot of potassium? They'll have like muscle cramps, okay, muscle cramps, muscle weakness, arrhythmia, irregular heart rates, and all of that. So those are the things you are monitoring for hyperaldosterone, because they're losing potassium and then they're keeping salt. Okay, I'll kind of end this right here. And again, these videos are just meant to enhance your learning.